The topic is carpal tunnel, and this is a structure which is there in your wrist. So the carpal tunnel is formed by the deep carpal arch, which is formed by the carpals, the bones. They form a concave surface. Medially, the bones that are present are the pisiform and the hamate. Laterally, the scaphoid and the trapezium will be done. The flexor retinaculum covers it, and there we go. That's the carpal tunnel. What passes through this? 9 muscular tendons will pass through this, along with the median nerve. The tendons, 4 of them are going to be from flexor digitorum superficialis, 4 are going to be from the flexor digitorum profundus, and 4 are there from the flexor pollicis longus. These tendons pass through, and the median nerve also passes through it. Now, in some cases, let's say there is tenosynovitis, which means inflammation, or let's say there's edema, or let's say there's some trauma. What will happen to the carpal tunnel? It gets compressed, and the median nerve also gets compressed, and that leads to a condition known as carpal tunnel syndrome. Now, the median nerve, after coming out from the carpal tunnel, it supplies the muscles of the thenar eminence. So the thenar muscles, the motor supply is given, and then the other branch is going to supply the lateral lumbricals, along with giving the cutaneous innervation from the fingers, starting from the lateral half of the ring finger all the way to the thumb, including the nail beds at the back. Okay, so this supply is going to get disrupted because of the compression. The patient will come to you with complaints of pain, numbness, tingling, pins and needle sensation over whatever cutaneous innervation I just described. And they will complain of weakness of the thumb. The thumb will lie like this. Now, let's give names to this. This is called the 8th thumb deformity, and you might have seen this in other lesions of the median nerve. It happens because of wasting of the thenar muscles. In fact, there might be flattening of the thenar eminence. Then, as for the pins and needle sensation, there is an important thing you must note. The skin over the thenar eminence is not going to be affected by this, because this is supplied by the palmar cutaneous branch of the median nerve, and that branch was given off before the median nerve entered the carpal tunnel. So in carpal tunnel syndrome, that nerve is not going to be affected. Sensation over here is going to be just fine. Finally, patients, they have worse symptoms in the morning when they wake up. That is because often when we sleep, our hands are flexed like this. So let's come on to this. This is known as Fallon's test. We ask the patient to flex their hand like this, and this elicits the symptoms. Another one is Tinel's sign. T for Tinel, T for tapping. Percussion over the flexor retinaculum again will elicit this. And another diagnostic criteria is a conduction velocity of the median nerve less than 30 meters per second. Now, carpal tunnel syndrome is treated by a stent. If that does not work, corticosteroids, and finally surgery might be required, where they will just decompress the nerve. And yes, that's about it.